Hi everyone, my name is Abby and I worked with Emerging Minds UK as the Big Question Research Challenge investigator during this summer. Emerging Minds are a research network that aims to reduce the prevalence of mental health problems experienced by children and young people. They're working across sectors and disciplines to tackle 4 research challenges. Their research challenges have been developed in partnership with young people, their families, practitioners, and policymakers. And as part of my role, I spent time talking to commissioners, and I'm joined by one such commissioner today, Lisa, who works for Liverpool's Clinical Commissioning Group. So thank you so much, Lisa, for joining me.
Thanks, Anne. Thanks for the invite. Yes, so I'm Lisa Nolan. I work for Liverpool Clinical Commissioning Group, and I work in the mental health team and mainly lead on children and young people's mental health commissioning.
Amazing. So the Big Question Research Challenge is one of 4 key research challenges which were prioritised. It explores why, when we know what works, is this not necessarily implemented in practice? So today I'll be speaking to Lisa about what it's like to implement research on the ground to support the mental health of children and young people. So, Lisa, what does evidence-based mean to you?
What does evidence-based mean to me? So I guess it's around understanding what works. It's around sort of, asking the questions around that as well. Looking at the research and the guidance, but also trying new things in safe and governed in ways as well. I think it's about understanding what works for different population groups and individual needs as well. And it's about looking at a range of factors, including, the likes of outcomes, quality, safety, finance, and also wider social impact, which I think is really important. And obviously utilising a range of methods to do that as well, but most importantly, service user voice as well, to actually really understand what works for them. I guess in health, evidence base is often based around clinical need. However, it needs to really focus wider than that and really have an understanding on what works to have impacts on people's lives, I guess, for me. And this is particularly true in mental health and children, young people's mental health, because it's quite systemic, and mental health is often impacted by the wider social determinants as well. So it's around understanding, what works to sort of to have an impact on those wider social determinants as well, which in turn could improve someone's mental health. And I guess as a commissioner as well, around evidence-based, I'm really interested in sort of the economic impact as well of things that work, specifically things around social return on investments and how things can save high cost in the future as well.
No, definitely. Those are some really important points. Thank you. So with that in mind, I guess, what are some of the challenges that you might face or have faced in your role when using the evidence base to inform practice?
I think really, to me, there's not enough research on the wider systemic models that are specifically provided by services outside of the NHS as well. I think we get a lot of research and nice guidance, for instance, which is only guidance on specific conditions, I would say, and what works, which is great, and we should be using that as well. But there's so much wider work out there now that we really, and different models that we really need to understand, and especially in children and young people's mental health, because they're a defined population. And often adult models are developed based on evidence base, and sometimes it's thought, oh, they'll work for children and young people too, but they don't. And, national policy around children and young people's mental health has moved, wider than the NHS now, wider than NHS provision. It talks about systemic change. It talks about utilising different models, different organisations outside the NHS, different workforces that are more engaging and accessible for children and young people and meet the needs a lot more as well. However, we haven't really got a lot of published research around those models. And now it's only in the world of evidence-based and research and models and development, is probably still quite new, but we still, there's lots going on, and we really need to be looking at that and what works, and then really how that's shared as well wider across the commissioning community and provider community as well, and more importantly with policymakers. We need to really join up research and academics and commissioning and service users and providers, and specifically those outside the NHS a lot more as well, and to look at opportunities of how we can measure impact really and understand what works. And something's not going to work, and it's not necessarily one model's going to work in one place and work in another, but there might be key principles around it that might be able to be implemented in another area as well. And we need to link those wider systems with research and evidence-based with policymakers really as well, which I think I said before. And a big key to this as well is actually understanding what resource and funding is available as well to carry out research to understand the evidence base. I'm not sure commissioners are that linked into that either, what's out there, what calls on research there are. And, working in the NHS, I guess, and NHS commissioning, it is usually NHS to NHS. Do you know what I mean? Commissioners to trusts. And really in the world of children and young people's mental health, we just, and I think I said this before, we really do need to be thinking wider than that, and thinking, third sector organisations, working with our local authority colleagues a bit better, really to see, what works, but also have an understanding of how we implement that research and evaluation around innovative practice, and that there's quite a lot of out there, but we haven't got that published research around.
Definitely. So that broader collaboration, I think, is so important. I completely agree. It's something we heard from when we spoke to parents and young people as well. So definitely. And are there any experiences which you've had that make it easier to work with the evidence base and implement evidence in practice?
Yeah, I guess, I've had a few experiences really. Was being very much part of the Clark programme, which is sort of a programme that brings together academics and providers around looking at what research is required to develop an evidence base around certain areas. And I was part of something called the Partner Priority Programme, and actually did a 12-month internship as part of the Clark programme, where I had an opportunity to work with the local universities, providers, and public as well. So patient and public involvement, it's called. So it was sort of service users basically, and to work with service users in order to evaluate a service really. And in Liverpool, we chose a third sector organisation that delivers mental health support for children and young people, and we evaluated that service, which was really, really useful. And I worked with service users and I worked with the academics in order to do that, and we did qualitative and quantitative research. So we did a lot of face-to-face interviews and group interviews with young people and parents, carers as well, and that helped from a commissioning perspective, because it helped inform what we needed to commission moving forward as well. It really demonstrated what worked and what didn't as part of that service. And it was a youth mental health model. It's a model that's been that sort of came out of Youth Access, who've done a lot of research around those type of models, and we really wanted to see how it was working in Liverpool, so it really helped demonstrate that. But it gave me an opportunity, I guess, to work closely with the local universities and academics and researchers. And then you provide, you get those links then to do future work as well, and understand the landscape of research and academia a bit better, which is a minefield, a bit like probably commissioning is to them, and and then health is to them. And I guess the opportunity came because in Liverpool CCG we do have a research lead as well, and so she tries to connect the commissioning aspect with the research and academia as well, and the evidence base. So that's been a real help as well, to have that person, because if there's any issues or any things you think you want to progress with, then it's a real opportunity to do that. I think in Liverpool as well, we have something called Liverpool Health Partners, which brings together all the academics and universities and providers as well. And that's not just trusts or health providers. It often works with third sector providers as well, and it takes more of a coordinated approach of what's going on and what research calls are out there as well. And they have different programs of work, so they'll have ones on Starting Well, which is more around children, young people, and they'll have ones on Living Well, which is more around population based approaches and early intervention and prevention, and they have a mental health network as well. So linked into that is really helpful, because you can get a grasp of what's going on. You can link into it from a commissioning aspect. You can support them with getting the right people around the table to look at things as well. So yeah, I've had a few experiences in that, and I'm part of I'm a collaborator as well on some research that's currently underway in Liverpool at the moment. So, work quite closely with the universities, but I didn't have that opportunity as an intern as part of the Clark programme. I'd probably still be, wonder what's going on out there as well. But it's helped as well. It's helped support innovative practice. It's helped put that evidence base. The research that we're doing is help important that research base around some of that innovative practice as well, and those wider approaches outside of the traditional children, young people's NHS provision too.
Definitely. No, thank you. Those sound like some really excellent opportunities as well, especially having the chance to actually speak to children, young people directly. I think that's so important. So finally, for anyone who's listening to this who might be looking to improve their implementation practice or just the implementation of evidence, what's one thing that you would ask them to prioritise going forwards?
I guess it's around, I don't think there is one thing, to be honest with you, so I'll probably say a few, but I guess for me it's really around understanding what's out there and who can support you in understanding evidence base really, and also putting some evaluation and research around new and innovative practice that you want to deliver. So it's around speaking to your local colleagues and your regional colleagues and your national colleagues with regards to that. But also I would say, don't be scared to innovate. That's first. Do not be scared to innovate and try new things and ask those questions, as long as obviously you have that robust evaluation, safe and governed environment around that innovative practice. Evaluate. From a commissioner perspective, we have to, we should be evaluating everything and understanding what works, to move forward and share. I'd say share, really, look around disseminating what you've learned as well. Share it with other colleagues, locally, regionally, and nationally. But I guess most importantly, it's around listening to service users, listening to children, young people, listening to families as well around their needs, because they're not all going to be the same, especially if you're from different population groups as well. So you need to have that broad scope and broad understanding around need, I guess, as well. So hope that helps.
Absolutely. That's amazing. Thank you so much for joining me, Lisa. It's been absolutely wonderful to speak to you.
Thanks so much for the invite, Abi, as well.
Thank you so much for listening. If you'd like to find out more about the Emerging Minds Network or about the Big Question Research Challenge, or any of our findings from speaking to parents and carers, young people, or commissioners, then do head to the Emerging Minds website, where you'll find lots of interesting information about priorities for implementation.